here now. Okay, Fatma, if you want to start now.
Yeah, for sure. So hi, everyone. Thank you so much for being here. I just want to start off by saying, thank you to the OPACC team for giving me the opportunity to do this. I really want to thank them for all they do for OPACC. I think it's incredible. So thank you so much for your continuous support and all the support that, you give to parents. I've been personally supported by OPACC, after my son's cancer diagnosis, and I'm very grateful to them. So I'm excited to be presenting to you ways that you can manage your anxiety after your child's diagnosis. So a little bit about me. I'm a mom to 3 boys. My eldest, Karar, was 5 years old when he was diagnosed with neuroblastoma in 2017. He's currently in remission. And, when he was diagnosed, I was a first year full-time psychology student. And I was already really interested in human emotions, but our family's experience with my son's cancer diagnosis really motivated me to be, immersed in the mental health field. And I think it's important to start off by saying that I'm not a mental health professional. I'm just a parent who knows what it's like to deal, with not only the physical part of cancer, but, the psychological worries, specifically anxiety. I have experience in the mental health field. So throughout my degree, I was involved in different mental health clinical labs that aligned with my interests to know what the research is saying. So I've been part of an eating disorders lab for 2 years now, and I actually did my thesis there on a new eating disorder. It's called orthorexia nervosa. It's a really interesting new eating disorder about health, eating clean and healthy. So that might be something that is really interesting to look or Google if you're interested in that. I've also been part of the psychosocial oncology lab, and after my son's diagnosis, I was really interested in learning more about resilience and adversity from a research perspective. So I'm doing currently research there, and I'm also part of the trauma and attachment lab. And I think OPACC circulated the recent article I wrote, supporting parents after a child's cancer diagnosis. So in this presentation, where I see myself fitting in is kind of bridging the gap between, someone who's having a hard time, who doesn't understand or struggling with anxiety or struggling to manage it. Sometimes the information can be overwhelming of what the neuroscience is saying. So I try to filter it through my own lens, of what works for me and what didn't, and what approaches I find helpful. And honestly, I think looking back when I was really struggling with anxiety, what I really wanted to hear is from someone who had felt the way I did at the time and had come through it and, could tell me that, you're going to be okay. So that's where I see myself. My goal is to normalize talking about it, even when we're in the middle of it, not when we're just come through it, right? So even when it's still happening right now. And sometimes we have this mental health perception, that one day you're going to get rid of this anxiety, but anxiety is never going to go away. It's just part of being human. What we do learn is how to manage it, understand it. We learn to redirect it. We just don't want it to control us. We want to control the anxiety. So this is what we'll be looking at today. So we're going to be identifying it and then understanding your anxiety triggers. It's really important to know what triggers your anxiety, so then you have a plan for that. And then looking at cognitive distortions, which is, kind of their specific ways of thinking, more like negative ways of thinking that can really impact our anxiety, and ways to manage our anxiety. And then I'll be sharing resources and a new free therapy platform that Ontario has just launched, which may be of interest to you and your family. Wherever you are right now with your child's journey, you may be struggling with anxiety, whether you've just received the diagnosis, whether your child has been in treatment for a while, or they're getting ready for surgery, or they finished treatment. or maybe your child has been doing well, and they've been in remission for a long time, but you're still dealing with anxiety. And despite where you are in your journey, the techniques to manage your anxiety are the same. So, some of the common worries of that, experienced by families who are affected by cancer are, fear of cancer recurrence, fear of mortality, fear of the effect of cancer treatment, or even thinking about, is treatment going to work? Thinking about how, if life is ever going to be the way it was before cancer, or even like financial implications. And the thing is, anxiety is something that everyone can relate to. Everyone has experienced it at some point of their life. And the thing is, fear is information. It's a signal, and it's a useful signal that tells us there's a threat that needs to be addressed. So it's actually a useful and productive tool. So for instance, anxiety can make us productive when we're ill, we seek medical attention. However, anxiety can become a bit more obsessive on the obsessive side and interfere with our everyday life when it may come up unexpectedly, which is called generalized anxiety disorder. Just sometimes the thought of getting through the day produces anxiety. People with, generalized anxiety disorder don't know how to stop this worry cycle, and it feels it's beyond their control, even though they usually realize that their anxiety is more intense than the situation warrants. Which brings me to my next point. Anxiety can manifest in different ways. So there's the mental component, so your thoughts, your feelings, and then there's the physical component and the behavioral component. And when we think about anxiety as problematic, we think about unproductive thoughts. So for example, it can be regretting the past, regretting something that has happened before, or worrying about the future, or black and white thinking. I can't do this, or I won't be able to do this. And sometimes it's not the thought, but also the feeling. And sometimes people become more angry because there's underlying anxiety that needs to be addressed. And sometimes we're not in touch with our anxiety, but it manifests in our ability to concentrate. Sometimes we're feeling on edge. We may experience flashbacks about distressing events. And, sometimes people, usually most of the time, experience anxiety physically. So there's pressure in the abdomen. There is some difficulty sleeping, loss of appetite. Sometimes it's very sudden, which is called an anxiety or a panic attack. And, the very important part of anxiety is the behavioral component, because that's what motivates action. So, sometimes if we're anxious about a situation, we either avoid it altogether, or sometimes anxiety overwhelms us and creates paralysis, so we can't take any action. And sometimes it's the opposite, we take too much action. So, for example, checking your child's body for symptoms, constantly checking emails over and over again for results. And the anxiety that is usually of concern is a downward spiral of the mental, physical, and behavioral symptoms built on each other. And the thing is, with anxiety, it comes in waves, and some of the triggers of the waves are predictable. So if it's your child's first appointment for treatment, or if it's a scan that you've been waiting for, sometimes the anxiety is actually after the scan, you're waiting for the results, which is extremely difficult, right? Sometimes we can predict that there will be anxiety at certain events, anniversary events, date of surgery, or date of diagnosis, sometimes even birthdays. Sometimes it's related to a child's physical symptoms. And the thing is, some triggers of anxiety is very confusing. Sometimes Christmas, brings anxiety, and that is normal. The most confusing yet a very powerful trigger of anxiety is end of treatment, when treatment has completed. And I want to share this quote with you by Sulika Jawad, and she's a cancer survivor. And one of her TED Talks, which is really great, by the way, I suggest you watch it. She said, "The hardest part of my cancer experience began once the cancer was gone." And although she's talking about her own cancer experience, this can be related to us parents, right? Sometimes when your child has finished treatment, there's an expectation to feel delighted and happy, and that's great. But we might also have a mix of other feelings. It can be a roller coaster of emotions. We can feel nervous, fearful, happy, and maybe self-conscious. Maybe you start to see your child's special esteem less often, and that might be something that you miss. You get the benefit from seeing people regularly and getting that support. And treatment usually creates a sense of structure. You're just focusing on the treatment. There's a lot of medical attention, and after treatment there might be a sense of abandonment that you're not used to, right? It's like a soldier returning from a battle. End of treatment is a time to process emotions. All of the emotions that we had to bury during treatment, they resurface. And even if it's a successful treatment, sometimes you feel grief because there comes a sense of loss with cancer, and we need to process that. And at times, your social circle might not really understand anxiety at that time. They expect you to be happy and normal, so they may not be available during that time. So it can be the time that you feel, the most in need, but least able to ask for it. And when it seems least available. And cancer might change plans for the future, and maybe we need to grieve that and revise those plans. And it shatters the illusion that you had before your child's diagnosis, especially the feeling of control, right? Like for us parents, that feeling of control, we can protect our children. There comes a sense of loss of that feeling when cancer comes. So there really isn't any one feeling that you're supposed to feel at one time. There's no set experience you should be having right now. It's very common to have a mixture of these feelings, specifically anxiety. And the second kind of most popular trigger is fear of cancer recurrence, and that's a universal concern for families. It gets better over time, but it may recur suddenly. And, we're hardwired to dislike uncertainty. They've actually done an experiment where they told people that you are going to get electric shock, if you're going to get electric shock, or you might get an electric shock. And those who were told that they were going to get an electric shock showed less fear, so they had less anxiety than those who were told that they might get it. So that's how much us humans fear uncertainty. So again, it's all normal. So it's good to remember that we know there may be some realistic possibility of a recurrence, so we can't eliminate those thoughts or feelings or worries altogether. The best we can do is be gentle and kind and find some ways to live alongside those worries that can enable us, to focus on the now, what's important to us right now. So that's what the bulk of this presentation is thinking about, how we'll make space for anxiety. But before I do that, I want to highlight about keeping an eye on some of, these fears and anxieties. If you're experiencing, a lot of these and you're getting stuck, that might be another indicator, that maybe it is a good idea, to seek a bit of extra professional help. So there may be these thoughts and images, we can get stuck in patterns of thinking, and they're called cognitive distortions, which are irrational thoughts where you see things a bit more negative than they really are, It's part of being human. It happens to all of us, but when it's constantly happening, it's a good idea to speak with someone about it. So for example, focusing on the worst case scenario, it will come back and I won't cope. Focusing on the negatives, I'll never be able to do things knowing it may come back. And if it comes back, there's no hope. Or us parents, we specifically are guilty of doing this, is overestimating our control of the situation, right? Like I have to do everything I can to prevent this cancer from happening again. Or if I'm not constantly keeping an eye out, something is going to get missed, right? So we go on this like overdrive. And And then jumping to conclusions, my child's headache must mean the cancer is returning. Or overestimating risk, despite what the doctors told me, I'll just know, we'll be unlucky. Or avoidance of thoughts, if I don't think about cancer, I won't be so anxious. Or rumination, thinking it over and over again, right? So avoidance of thought is kind of like the opposite of rumination. One is avoidance, and one is more of like you're approaching it with continuous thinking. So, when we have these thoughts, we feel much more anxious and we engage a lot of things to deal with the anxiety that we're experiencing. We may start checking our child's body or go into overdrive mode and start Googling online to read about past stories people experience with similar type of cancer, or we might avoid to deal with cancer altogether, like I said earlier. And I think the most important thing here is about balance. It's okay to search for information and go over your, information, but just noticing whether that anxiety is meaning that you're spending a huge amount of time doing those things, which is increasing your anxiety rather than reducing it. So often what happens to us, especially in the future, is not within our control, but what we can control is the here and now, in the moment. So we'll be looking at ways to manage those overwhelming thoughts when they do come. And our purpose is not to stop them or prevent them, because that is not possible. Like I said, we're all human, we're going to have those thoughts. But we're acknowledging that we will experience anxiety, and we are looking at coping mechanisms that will help us when anxiety comes. And here we have the anxiety monster. You can't get rid of your fears, but you can learn to live with them. This is kind of like a visual depiction of the ways, that we'll be looking at and going over to manage anxiety. So number one, find out the facts for your child. It's very tempting and it's very hard not to compare. And I was so guilty of this, not to compare your child's diagnosis to other children. Your child is unique, their situation is unique. So it's really important to take your experience as yours and not to compare and contrast with what other children might be experiencing. And try to be confident that, the doctors know their stuff. It's knowing what's relevant to you, and that your team knows your child well, knows what treatment and advice is best for your child. And it can be really helpful to ask your child's team for information about your child's particular risk and what's important for you to be looking out for. And in the case that you are going, overthinking this, and you're going in like that mode of like, oh my gosh, like something is wrong, I need to like talk to someone. So when you have these concerns, it's a good idea to have like a shared plan with your child's healthcare team, who to contact, how you can, so that way you can feel safe to get your questions answered, and be reassured. So if you have any worries, then you know the right person to go to at the right time. So for instance, I had like the nurse's number, the nurse on call every time an anxious thought came in terms of like my child, my son's cancer. Sometimes I would call her, and you know what, that was like very reassuring for me, because I feel like that service that they have, when you can call the nurse at any time, it really helps parents kind of not only like with this for the child, but it really helps parents to kind of make sure that they're on the right track and you're not like going overboard with your thinking. And it's useful to know that if you are feeling anxious, it's helpful to ask yourself, what have I been thinking that may be contributing to how I'm feeling, right? Sometimes people find it helpful to jot down, because that can help them take a different perspective. And there's all sorts of questions we can ask ourselves to give a more balanced and realistic way of thinking. So if we do notice an anxious thought, we can ask ourselves, is that thought accurate? Is there proof that supports my thought? So for instance, a situation where we're saying, the cancer will come back to my child and I won't be able to cope anymore. Maybe a more realistic way of framing it is, the cancer may come back, but even if it does, our family has already coped with treatment and we can probably do it again. So the key thing here is you're not expected to, take a difficult thought and turn it into a super positive, unrealistic thought, because that isn't helpful, right? It's about gaining a realistic, helpful perspective. So getting that balance really, like there may be some difficulty ahead, but acknowledging ways that it will be manageable. So as I mentioned earlier, everyone has triggers that may increase their anxiety. When we have scans coming up, that might be anxiety provoking. It's also known as anxiety. So again, we're not going to get rid of anxiety, but it's just knowing how to deal with it when it shows up. So thinking about having some distractions or focusing on things the day before, writing a list of questions for your team if it's the follow-up appointment from the scan, and having a pen and paper, it can be helpful too. And just having some things with you in the waiting area that can be a distraction. It's also useful on the day of the scan to plan something to do afterwards, something that is like a space to decompress of all that anxiety that's been building up, something later to enjoy with your family. So for instance, for me, after every checkup with my son, we made it a habit to go to the Eden Center and shop together. And it was something we looked forward to after every appointment. So that specific day had the scan, which is anxiety provoking, but going shopping was something that alleviated my anxiety. And what's interesting about doing that? You can literally train your brain to think of something negative as more positive, So every time we went to do a scan, my brain automatically associated the scan appointment with us, going shopping, which was something we both enjoyed doing, and that unconsciously lessened my anxiety over time. So find something that's meaningful to you, to your family, that you enjoy doing on that day. It can be an activity, your favorite ice cream store. Make it a habit to do that every time, every scan or appointment. And then thinking about anniversaries. So that may trigger your anxiety. So for example, anniversary of a treatment or of surgery. I think it's really important to connect with others on that day, marking it down, talking with other parents, or keeping yourself, again, busy on that day. One of the metaphors I like to replay in my head is thinking about anxiety like waves in the ocean. When there's a big wave and fear is in the ocean, there's a big wave that's coming at you. You can try to run away from it, but it'll be faster than you, and it will knock you down. You can stand up and resist it, but again, it'll be stronger than you and knock you down. So the most productive thing to do is to dive deep, is to dive under and let it wash over you. And this is what many mental health professionals try to teach people when they're dealing with anxiety, which is radical acceptance, and that's to let this wave wash over you. It doesn't mean that you like or agree with your thoughts or feelings or give up to your thoughts or feelings. It just means that you're observing them like waves instead of getting them tangled up. So how do we dive under? How do we dive deep? How do we let this anxiety wash over us? So the first thing to do is acknowledge and observe. A lot of times our thoughts are so fast and so automatic, it's hard for us to recognize that we are starting to feel anxious. So it's important to acknowledge and observe it. And when an anxious thought comes to mind, it's important to notice it, and not just notice the thought, so you can identify the thought, but it's also important to identify the impact it has on your body. Because remember, we said that anxiety manifests also physically. So where do you feel it? Anxiety? Is it in your chest, abdomen? What is it motivating you to do? There is like the behavioral implication. And when we have a wave of anxiety come and we want it to wash over us, it's helpful to remind ourselves about this metaphor that it makes sense to have anxiety and that is just a wave. And from time to time, you'll experience a wave, and like a wave, it will start coming, it'll reach a peak and then go away. And one of my favorite quotes is, you don't have to believe everything you think. And when anxiety comes, sometimes it's helpful to remind yourself that you don't need to argue with your thoughts, you don't need to believe them or identify with them. They're just thoughts, just like any thoughts, they'll come and go. Sometimes the waves of anxiety are very strong and it feels like a tsunami, and we're overwhelmed and we can't do any of those things. sometimes then it's helpful to remind yourself that emotions aren't really permanent. It will go, it will pass like any other moment or wave like anxiety. Sometimes it's hard not to engage in this tug of war or try to resist and then feeling bad about it, feeling bad about not being able to stop it. It's important in these times to talk to yourself like you would to a good friend. Sometimes we're very hard on ourselves and we say things to ourselves that we wouldn't say to other people. And if we heard other people say those things to us, we wouldn't want to be around them. So it's good to remind yourself, can I talk to myself differently? And when we want this wave to wash over us, it's important to find an anchor in the water and kind of be still until this wave comes and goes. Our breath is the best anchor because it's always available for us to use. There are many ways to anchor ourselves through breathing, and you kind of need to experiment with it, and see which one fits for you. When we try to anchor ourselves in our breathing, we feel this wave of anxiety. This is actually quite difficult because sometimes, again, we're engaging in this tug of war, and these thoughts and feelings in our bodies kind of make us forget to breathe. And that's why it's important to do something in addition to breathing. So for example, you can use counting, just counting 10 breaths. So 1, and then just keep going to 10, because counting can give you something to focus on and help you anchor yourself in your breath. Or using like a mantra, a simple phrase while you're breathing. So for example, I've seen this and it's very effective, honestly. I have tried it. So when you're taking a breath in, you say, this is for me, and then you breathe out and say, this is for, whatever person, like someone you love, someone important in your life. So you go, 1 for me, and then 1 for you, and just keep doing it until you feel, the wave pass. And if the wave comes again, you do it again. And a lot of times we feel tension in our stomach or the chest area. So sometimes it's helpful to just put your hand on your heart or your chest, wherever you feel the tension, and focus on the sensation of breathing, of your chest rising. And that can help you anchor yourself in your breath. Fifth thing I want to mention is a coping toolbox. And that is basically a physical toolbox filled with items and notes of coping strategies to help you calm down and express your emotions. It should be created at a time when you're not really anxious or stressed and can properly think of effective coping strategies or items. Keep in mind, though, this toolbox can take some trial and error. Sometimes you think something's going to work and it doesn't. So it can take, some trial and error. So for example, for your sense, using a weighted blanket, a massager. For me, face mask, the sensation of the face mask on my face kind of like helps ground me and just be in a moment and stop these racing thoughts. A stress ball. Stress balls also are helpful for anxiety. For your site, maybe it's a mandala, maybe it's your favorite painting, maybe it's a family picture or a place that you hope to go with your family. For sound, having in that box maybe like a playlist, or your instrument, that if you play an instrument, or just a playlist, right, of like your favorite song or anything that soothes your ears. For smell, essential oils, like do not underestimate the power of lavender. And that is honestly my favorite, is the smell. Having that specific scent, just kind of making a specific scent for you, or a specific spray bottle. There's so many of these now. So when you're feeling anxious, it can really help to calm you down. And then for taste, like your favorite snack, or your comfort snack. And this is something you can actually do with your family, with your kids. I know my kids love doing this. You can reach for it. You can put it in your living room, somewhere easy access, and reach for it at times when you notice your anxiety levels are rising. And you can reach for it periodically throughout the day for a more proactive approach, even when you're not experiencing anxiety. And, you can create a mental toolbox too. So creating a list on your phone of things that help you, right? So breathing exercises, meditation videos that have helped you, funny movies, and affirmations. And there are so many benefits to box breathing, physiological and psychological. It can have a great impact. The impact on your body is amazing. I'm going to show you a short video of box breathing, and I suggest you try it now with them to practice so that in the moment when you are feeling anxious, you can use that from your mental toolbox. So just a second. Okay, please let me know if you can hear it.
I can't hear it, Fatma.
Oh, you can't hear it?
No, I can't, Sarai.
Okay. I don't know why this is being funny. Okay, this is my last try. If not, I'll just send you guys the link. How about now?
Did you, I'm sure you did because you've probably used Zoom a million times, but click when you hit shared screen on the little box that says share audio in the bottom, I think, left corner.
I don't have, it says computer audio. Oh, perfect. Thank you.
Oh.
Okay, let's see if this, okay, let me know.
Feelings of stress or anxiety.
Just a second, I have to, oh, it's,
You know, when you hit share screen, the window that pops up when you pick your screen, in that little box that pops up, there's a little box in the bottom left corner that you have to check mark, and then that'll share the audio.
oh,
In these moments, you can use your breath to help calm those feelings. Box breathing is a simple relaxation technique that can help you reset your breath and return to its normal rhythm. You can do it anywhere, anytime. Box breathing can help reduce stress and improve mood. It can also help with controlling and managing emotions. It's very easy to learn. Imagine breathing around a box. Inhale as you visualize going up one side of the box, gradually filling your lungs with air. When you reach the top, hold your breath for 1 to 5 seconds as you picture going across the top of the box. Exhale gradually as you imagine traveling down the other side of the box. Pause again for 1 to 5 seconds as you go along the bottom of the box. Then repeat. This can be done 7 to 10 times in a row, focusing on the breath. If you can do it sitting down with your feet grounded, that will help too. But really, it can be done anywhere. Box breathing has physiological and psychological benefits. Physiologically, it regulates breath, increases oxygen to the lungs, and can help reduce blood pressure and lower heart rate. Box breathing can help psychologically by providing focus to your breath and removing attention from the things that are causing feelings of stress and anxiety. The repetition of box breathing can also help reduce stress. So, in moments when feelings of stress and anxiety are overwhelming, remember box breathing and the power of your breath as a simple way to relax and breathe a bit easier.
Thank you for that, Roberta. That was helpful. Couldn't figure it out for the life of me.
No problem. I run virtual programs every day.
Okay, and so now we saw like the impact that box breathing has. And let me tell you, first, when I heard about box breathing, I was like, you know what? I've heard so many of these like breathing techniques, you know, like to count to 10, or like you put your hand on your stomach and you like feel, you know, the sensation of you breathing in and out. But I don't know what, there's something about this box breathing that has been extremely helpful. And now it's like the thing is with this is like you need to try to implement it more for it, and then you'll see the benefits of it over time. And so the next one is the 5-second rule. And this rule is used to rewire your brain. So after you found your trigger, you know, for your anxiety, that will help you come up with a plan for how you're going to catch yourself when, you know, your mind defaults to the automatic ways that it thinks. So, you know, first you want to write down what is your trigger. Then I want you to write down what exactly you're worried about. So for example, the trigger is the scan appointment coming up. What I worry about, I worry that my child's cancer has come back or progressed. Then you're going to write down your anchor thought, which is something that weighs you down and it makes you excited. So here's how the strategy works. With the 5-second rule. The next time you are in a situation where you're having an anxious thought, you're going to go 5, 4, 3, 2, 1 to interrupt your mind, and then you're going to drop in the anchor thought. For instance, the last time you heard good news from the doctor, or the last time that, you know, your child's symptom was not related to cancer. And that really helps you what that helps you to do is it does not let your mind hijack you. So it's very important because, you know, there's a very tight axis between your habit of worrying and spiraling your thoughts and the way your body starts to amp up. And we want to settle your mind so we don't agitate your body. So if you start to practice that over and over again, that will stabilize your body. The 6 things that you can do is you can have something that you can look forward to, something that can give you enjoyment or pleasure. It's really important that your child's illness doesn't have to be all that you are as a family, as hard as that is. It's been a part of your experience, and it may be a part of your experience going forward, but it's not like your entirety as a family. So you can process difficult emotions, but also have things to look forward to. So starting to think about things you may want to get back to. I know it's difficult a little bit still sometimes with some places still closed for COVID, but maybe trying to revise your plans, or going back to things you didn't have the time to do before. When it was the beginning of the diagnosis, if right now you're like towards the end, maybe trying some new things like calligraphy, watercolor painting, starting a garden or making a family scrapbook. So really, taking that proactive approach and trying to do something different, something different that you haven't done before, or doing something that you've always wanted to do before, or going back to do something that you did do before that you enjoyed and you've just kind of let it on the side burner for a long time. Now, thinking about sleep, which is so important, researchers found the relationship between sleep problems and anxiety is bidirectional. So that means, sleep problems can cause anxiety, and anxiety can disrupt your sleep. And because sleep and anxiety have such a strong relationship, let's talk about ways that you can manage anxiety through sleep. So sometimes anxiety can make us toss and turn at night, have racing thoughts, heart palpitations, constantly waking up in the middle of the night. And if you notice that happening to you, you may want to, consult your doctor. But now we'll just discuss kind of like additional things you can implement in your routine so you can fall asleep easier, which might lessen your anxiety. So first, journaling before bed. You don't have to feel anxious to journal, it's good to journal before bed every night. In one study, they found that participants who journaled before bed fell asleep faster than those who didn't journal. Second thing is stretching. It can really help. So it's not a good idea to exercise like doing cardio or like some sort of exercise before bed, but sometimes like some light stretches can help you fall asleep. And again, don't underestimate the effect of essential oils like lavender can have on easing anxiety. Lavender is known for its ability to create a relaxing atmosphere. Actually, one of the main benefits of lavender is that it can calm your brain and your body. It can ease anxiety by affecting the body's flight or fight response. And try to go to bed. I know it's hard, but try to go to bed every day at the same time. I'm a mom too, and every day looks different for me. I understand, but just trying to set that structure kind of sets the rhythm for your body. And obviously, staying away from light or phone, staying away from your phone firstly, it's because of the light, but also, being on your phone before bed can really be anxiety triggering. Like I know the days that I'm on my phone before I go to bed, like going from one social media platform to another before bed is like I'm here clicking Instagram, Facebook, it's just never ending. And that I notice myself, like my body, it affects my body. I get all like hyped up and then I can't sleep. And then, looking at lifestyle choices. There's a whole world out there of scientists looking at the connection between your gut bacteria and the brain neurotransmitters and finding, what they're finding is like amazing. So, when you stick to a diet of healthy food, you're setting yourself up for fewer mood fluctuations, a happier outlook, and an improved ability to focus. Studies even found that healthier diets can help with depression and anxiety. So don't underestimate the power of your veggies and fruit on anxiety. And then obviously going back to maybe exercises you enjoy, it doesn't have to be like cardio or anything. It could be something like as simple as yoga, something as simple as Pilates or whatever, right? And then obviously less alcohol and caffeine because they're very triggering. And let me share a story with you. I found I like bubble tea, okay? And every time I'm feeling a bit anxious, I'm like, let me go and get my comfort drink, right? So I go and I get my bubble tea, and then I find that after I'd had my bubble tea, like I'm just feeling more anxious now. And I didn't know I was lactose intolerant then. So I get with the one with the milk, and I just knew this like cheese was like the milk was just really, really like making my anxiety so much worse. So also knowing your triggers, right? Because each one of us is different. So I had to find an alternative. I can still have bubble tea, but not not lactose. And when we're trying to deal with anxiety, it's very important to be patient with yourself and practice. So practicing these techniques we talked about today, a lot of the times we think about progress, which is true not only for our ability to deal with anxiety, but it's true with anything in life, right? We assume that progress is linear, and actually it never looks like that. It looks like ups and downs and weird maneuvers. So it's very important to be patient with yourself. And if there are waves of anxiety that overwhelm you, that's okay. Start again and practice, start again and practice. And if some of these tools I suggested appeal to you, then practice them when you're not as anxious. A lot of people try some of these tools right in the morning, so your mind remembers when to use them, when you are anxious. It helps your mind kind of remember them when you need them. Lastly, I want to share Mind Beacon, which is an online therapy-assisted cognitive behavior therapy program, and it's free. So Ontario, I think, recently made this free for Ontario residents, and it supports people experiencing, depression, anxiety, stress, trauma, or any mental health concern. And they're offering this for anyone 16 years of age or older. So if you have teens, kids, older kids, it's really helpful. It's really cool, and it's first of its kind because it has like a therapist guided program, live therapy sessions, and then they also have immediate crisis support. And it's really simple. It starts with like a homepage asking you, how are you feeling today? And then it prompts to like different questions. And then it suit, depending on what you answer, it like brings up more questions to suit your needs. Here are some books I have read. I've read a lot of anxiety books, and these are some of the best ones that I'm suggesting. The first three are actual books. The second one, it's a really nice one, the orange one, Don't Feed the Monkey Mind, because it kind of brings it in a humor kind of way. So it was really nice to read. And then the last one is actually a workbook. So it's about working with your thoughts. So a little like CBT, but self-guided. And then if you enjoy podcasts, I really suggest these ones. They're the most popular ones, and I listen to them a lot when I'm driving. Sometimes when I'm just doing like some things in the house, chores in the house, I have these on. It's very helpful, and it helps you with your thoughts, but it also helps you with like when it comes to your kids too, like how to manage your anxiety with your children, or if your children have anxiety. And I want to leave you with this. This is a Japanese pottery technique of mending broken objects by filling cracks with gold to represent the belief that when something suffered damage and it has a history, it becomes more beautiful. Sometimes in the process of repairing things that have broken, we actually create something more unique, beautiful, and resilient. And I just want to leave you with this because, we talked about how anxiety and fear from the trauma of cancer, but trauma does not only bring anxiety, it can bring growth. And studies that have looked at post-traumatic growth and PTSD showed that they are directly related. So when you experience post-traumatic stress, you're also more likely to experience post-traumatic growth. And I just want to thank you so much for, listening in to this, and I really hope it was helpful.
Thank you so much, Fatma. This was wonderful. Excellent presentation. You answered already so many questions our parents had submitted in advance. If you have any questions, you can just ask them now. or type them in the chat. And Fatma, I guess you can stop sharing the screen so we can see. Thank you.
Yeah, that's a good idea.
So, yeah, if you have any questions, ask now. Otherwise, I do have some questions that parents submitted in advance, maybe to get things started with the Q&A. You answered already questions. A lot of them were around what you mentioned, anxiety, the fear of recurrence as the constant source of anxiety, ongoing triggers, and the end of their child's treatment, which you've touched upon. Any books that you recommend, that was great. You did already. Now, one parent was wondering about teenagers and how do you learn or to manage, I guess, anxiety with teenagers post-treatment, specifically for teens.
Yeah, so I think a lot of what's wonderful about these techniques is that they can be used for different age ranges. So for example, the toolbox, us adults can use it, and then children can use it, and teens can use it. So I think trying to like play around with the different techniques that I have provided today, and looking at what your child is most kind of like responsive to, or your teen is responsive to, what techniques works for them. And if you're noticing that it is kind of their anxiety is like really something that is affecting their daily function, like it's affecting them like on like impacting them on another level, then I have the Mind Beacon. That's the resource there I offered. It's wonderful. It's free cognitive behavioral therapy for if you're an Ontario resident, and that's more of like professional help. Yeah. You're muted, I think.
Yes, thank you. I was saying I hadn't even heard of Mind Beacon, and I'll definitely add it to our OPACC mental health resource page as a link as well.
Yeah.
Just before I go on, anybody have any questions now before moving on to the next one? So there was one parent who wanted to know, how do you find a therapist that understands the trauma of the childhood cancer journey? The support for siblings and parents seems forgotten.
Yeah, I think, wasn't it a last presentation? Was it Wellspring?
Yes.
That I think, yeah. So they, from my understanding, they have so counseling sessions for families. So if you join, so if you kind of join their program, and I think it's free, they give you like tailored therapy sessions, like with a mental health professional, and they deal specifically with cancer, all types of cancer. So I think that's a great place to start from.
Yeah, that's right. Wellspring, and I typed in the link there, wellspring.ca. They do have virtual therapy sessions that are free for anyone to access, and they're specifically for cancer families and patients. So that's one. And we do have, I don't know if she's accepting new patients or what, but Tina Smith, she's a parent that's also a therapist, and she's done presentations for OPACC before. And if anybody's interested maybe in touching base with her, Tina J. Smith is her name. She's based out of Woodstock area, but she might do, virtual sessions and things like that too. So yeah, those are some resources for therapists who understand. And there was another question from a parent wondering not so much about anxiety, but about feeling guilty. And she says, how do you get over the guilt of not figuring out your child's condition earlier or not pushing doctors harder so it was found earlier? So it's about guilt.
Yeah. So I think guilt is such a tricky thing, especially for us parents, right? When it's related to cancer, and then something like it can be like things even outside, not even like related to cancer, but when you're talking about cancer, I think it's important to go back to the point I mentioned earlier. Is if your friend came up to you and they're beating themselves up for not, catching that cancer earlier, or for not pushing the doctors to do this earlier, what would you say to your friend, right? I think we're so hard on ourselves, and specifically cancer, like it was probably your first time dealing with this, and you did the best you could as a parent at that time. So I think trying and getting and saying, oh, maybe if I did this, things would have been different if I did that. That will not really change the fact that it has happened, right? And it did happen. And I think you as a parent did everything you could. So it's important to, you know, treat yourself with kindness and compassion. And just like how, if it was, like I said, like someone coming to you who's telling you this, what would you say to them, right? But if, you know what, this guilt thing is like beating you up every day, and this is just something you're constantly living with, again, I suggest Mind Beacon, because the thing is with these thoughts, right? Again, they're cognitive distortions. So it's all negative thoughts that we're having. And the best kind of, one of the best ways to deal with that is, okay, the techniques I provided, but if these techniques, you've been trying them for a while, they don't work, maybe cognitive behavioral therapy, right? These things kind of help you restore those thoughts in a more positive manner and more kind of realistic manner. Because you know what, as a parent, like there is no way, like you did the best you could. I hope that like answers your question. I know guilt is a little bit outside my scope, but hope that answered your question.
Thank you. And Roberta typed in here, Allison Parnell is a therapist who understands it. She was a child life specialist based out of Barrie. So I'll write that into Allison Parnell. Thank you, Roberta. Those are all the questions I had from parents submitted in advance. But if anybody has any questions before we wrap up, please don't be shy, ask in the chat.
I just wanted to say thank you for just validating how I'm feeling. I think that's,
no problem.
like, I know it's anxiety, but we're coming up the end of our treatment on December 12th. And I've had more anxiety now than I have had throughout the whole time, I think, because it's like, now what? And everyone's like, oh, you should be so excited. You must be so happy. This 2.5-year journey is almost done. And I'm like, no, that's not how I feel. So it's just nice to have that validated. So thank you.
No problem. I'm happy to help.
And before we go, I just want to mention, so OPACC has our weekly drop-in sessions virtually with our parent liaisons every Tuesday night at 7:30. And it's sessions like this, just talking with our parent liaisons about any questions, resources, just feeling connected with other parents who understand, you know, what you're going through. And also, Fatmah will be joining our parent liaison sessions, drop-ins, starting in January, a couple times a month, right, Fatmah, to start. And she'll be in for part of the session, so she can offer some guidance and mental health advice like she's done now, which is wonderful. Thank you so much. And we'll announce that through our social media pages and e-blasts and things like that when we're ready, but it's January 10th, right? That's what you're looking at. Great. And so this was our last virtual presentation like this of the year. We won't have any in December because at the end of December, nobody, you know, everybody's busy. So if you have any suggestions for speakers or topics for next year, please let us know at OPACC. info@opacc.org is the email, or through social media. And as Susan said, please feel free to join us anytime for our Tuesday drop-ins. And it's right, everyone is welcome, no matter where you are on your child's journey, whether newly diagnosed or in the midst of it, or even at the end of treatment, or even bereaved families, everybody's welcome to join us. So thank you so much again, Fatmah, for a wonderful presentation.
No problem. Thank you everyone for staying and listening.
All right, thanks everybody for joining us tonight. Good night.